Okay, so we just heard about the Düsseldorf patient, one of the few patients that's been actually cured of HIV, and I'm standing here with Dr. Jensen, who was heavily involved in the care of this man. So if I ask you, what was some of the keys in actually making sure that this cure became true?
Okay, obviously this was a team effort together with our hematologists and many virologists and many other scientists. And obviously also Marc was very important because he was so keen on helping, on doing what we discussed with him and so on. So first of all, I mean, obviously the leukemia was the starting point. This was a very desperate situation. So the plan was not to cure HIV. The plan was to basically cure the leukemia, and the HIV was the bonus. So we tried to get, since we had to do the stem cell transplant, a donor who could not just with the stem cells cure the leukemia, but also because the specific variant is there, had a very high chance of its stem cells to cure HIV, and this actually worked out. But there were high risks. It was a very risky procedure, and this is why we have to do further research to get to better strategies to cure HIV.
You talked about being optimistic and realistic, I think, in your speech here. Can you explain a little bit more about that? What should people think for those of us that are living with HIV? Like, is this a viable route, and what can we expect from the future?
Obviously, stem cell transplant is not a feasible strategy to cure HIV because it's just too risky. I mean, you have a mortality just by the stem cell transplant about 15%. So this is very, very high, and this is only justifiable if you have a deadly disease. You have to do it. And HIV is not a deadly disease anymore because it can be treated very well with antiretroviral treatment. So at the moment, I think the important thing about these cases is that we learn a lot about the HIV reservoir, about what type of strategies can help to reduce the HIV reservoir, and why in this or this patient it worked or it didn't work. So we get a lot of information here and there, and if you combine all the information, this may help us to guide future strategies to get to better, to more feasible, to scalable, and to less risky cure strategies. And it's very difficult to tell how long this will take and whether it will be really possible to come to a, let's say, really very low risk, scalable strategy. But if we don't try, there is no chance to achieve it.
So you're sounding fairly optimistic and fairly hopeful for maybe at least taking steps forward when it comes to a cure in the future.
In taking steps forward, yes. Whether we reach the goal is very, very difficult to tell. But you know, it's a matter of time. I mean, let's say like 50 years ago, we didn't knew that HIV existed, and when HIV came up, it was a deadly disease, and we did do a lot of progress in preventing HIV with PrEP, in treating HIV with antiretroviral therapy. We did do a lot of progress. So in let's say, especially the last 20 or 25 years. So if we think like not just 2 or 3 years in the future, but if you think like 5, 10, 15, 20 years, there may be things possible we can't even think about right now. So yes, optimistic on the long term, but also realistic that it's not that easy and that it will perhaps take a lot of time to get to better strategies.
One final question. One thing that stands out is that Germany seems to be heavily mentioned when it comes to, we have the Berlin patient, the Düsseldorf patient, the second Berlin patient. Why is Germany so successful when it comes to working with the cure of HIV?
I think there are 2 reasons. The main reason is that Germany has a very active bone marrow transplant register with a lot of donors in it. So the chances of finding a suitable transplant even perhaps having the special variant, this delta-32 homozygous variant, is high in Germany because we have so many donors here, and obviously the German donors are very fitting for German patients. So this is one reason, and the other reason is also that Germany has the resources to do research and do this complex. Obviously in resource-limited countries this is very difficult because stem cell transplantation is very expensive and also the research is very expensive.
So thank you very much.
Pleasure.